I'm an orthopedic surgeon. I do hand and upper extremity surgery. I specialize in both pediatric and adult complex deformity and elbow surgery. I have been the chair of the Department of Orthopaedics and Rehabilitation at the Yale School of Medicine since 2019. I am also chief of Yale New Haven Health Orthopedics, which is a 4-hospital system in Connecticut. And I'm also the director of graduate studies for a new master's degree program that we started, Master's in Personalized Medicine and Applied Engineering. I serve as a board of directors for a nonprofit that I started called the Perry Initiative, which is a nonprofit geared towards supporting young women into the fields of engineering and orthopedic surgery, 2 fields that have single-digit percentages of women. And I'm also doing global outreach in various countries across the world and trying to provide both opportunities for learning and providing care in underserved areas. My experiences there catapulted me to my life and career. I started in physical therapy school when it was a combined program through Bowling Green State University and University of Toledo, all coming together at Medical College of Ohio then. And I'm sorry, but I can't get that out of my brain, so I may inadvertently refer to it that way. I got my start as a physical therapist. Through that career, I met Dr. Jacqueline Perry, who was one of the few women orthopedic surgeons at that time and also a very prominent orthopedic surgeon. I'd read her at that point in time, and really still to this day, the book on gait analysis, which as a physical therapist you had to know. And then I got to work with her as a PT in Los Angeles, and she was the one who, after interactions with me, said, what are you doing here? You need to go to medical school or get your PhD. And then I said, which one? And she said, if you like people, go to medical school. If you don't, go get your PhD. She's pretty black and white. So that spurred me on to go back to medical school because, quite frankly, at the time, I didn't have anyone in my family who had been a doctor, didn't really have the, I didn't think I was smart enough to do that, even after going through a really rigorous PT program and knowing that I was sitting in classes with medical students. It's still, for some reason, I had a mental block there. And so I went back to Medical College of Ohio to go to medical school. And they were one of the first ones to accept me. I may have only gotten into one other place. And I went back to medical school to be an orthopedic surgeon, not to become a doctor. I knew at the time that that's what I wanted to do. And I think that the thing that I learned that was true both in physical therapy school there and medical school is that the faculty were really hands-on. They were not, hiding in their research labs. We rounded with attending surgeons and learned from attending surgeons. And, in my 25 plus year career now in academic medicine, it's not like that everywhere. And so that had a big impact on me, both in my learning, but then also how I wanted to be as a grown-up in academic medicine. And I think that, those really were the big ways that my entire experience when I landed there as a PT and that, brand new program there, I think I was the 2nd or 3rd class to graduate from the physical therapy school. Had I not had that opportunity at Medical College of Toledo, then I wouldn't have maybe not had the opportunity to go to medical school and have the career I have today. Throughout my life, I've tried to make the most of every opportunity that's come my way. And if I didn't have an opportunity, sometimes I created one. And I think, at the very core of it is my wanting to have a career that impacted people, impacted the community, and it was something that I was passionate about. And I became passionate about musculoskeletal medicine as a physical therapist, but I became intrigued and engrossed in how surgery could help correct problems that people were having. And it's so tangible and so almost immediate with the types of people that we see in orthopedic surgery and the types of problems that we address. And it makes such a huge impact on people's lives. And that was why I started in this career, but I've had so many great opportunities being in academic medicine, first at University of California, San Francisco for 20 years, and then now at Yale. And it really, is a fulfilling career. I continue to say, and I learned this from my mentors, it's truly a privilege to do what we do, to have someone walk into your office and say, yes, I trust you to cut me open and fix me and help me. That's a really huge thing. And I take that very seriously. And I try to instill that into our trainees as well. I think the other part of my career that's been about advocacy for women and minorities is also just a passion for me. I think that if you find a career or anything in life that you're passionate about that makes it feel like it's not a job, then it doesn't feel that way. And my career has flown by. I am amazed at this point that I'm now the senior person in the room, and that many of the people that work for me, I trained, and many of the people that are running other departments, I trained. And that's also one of the reasons why I wanted to do academic medicine and academic surgery, because I think it's like a ripple effect on a pond. You get to, in training other people, you get to pay it forward and have such more of a far-reaching effect and impact. I don't do what I do in hopes of getting awards. I don't think most people do. But what it means to me really is a chance for maybe others who were kind of in the same boat as me, girl from a big family, small town, Ohio, not a lot of opportunities, educationally and otherwise, to see what someone who in similar circumstances has accomplished and maybe inspire them to keep going. Working hard enough to become nationally and internationally recognized as an expert in my field in both adult and pediatric elbow surgery and complex deformity correction. If I had to pick one thing, that would be it. And the reason for that is, in doing so, I've helped thousands of people get better, and I've taught hundreds of people how to do what I do. And so it keeps going. It's a living legacy. And, an example of that would be doing the first that we know of elbow to elbow transplant for a gentleman who had no functioning extremity. And if I could only point to one thing, it would be that, because that was a culmination of all of the experience that I've had in my career coming together to help someone that was incredibly impactful. Other things are becoming chair at Yale as a woman who, went to public school and grew up in Pemberville, Ohio, and attended Medical College of Toledo, to end up at that point in time, one of only 2 sitting women chairs at an academic institution. That's right up there too. And I would say, in addition to that is the nonprofit that I started with Dr. Jenny Buckley, the Perry Initiative. My fondest memories are hanging out with my classmates and my teachers. Sometimes those lines blurred in terms of, you felt like you were really a colleague to the people that were teaching you. And, celebrating after big exams with classmates, and even studying with classmates and working through it together and building those bonds that really last a lifetime, because of, it's difficult. But the really difficult times were really balanced with, fun times outside of work with the people that you were sort of in the trenches with. I don't think I'll ever forget their names, is Richard Yastings in the Department of Anatomy. I think I was scared to death of him when I came through as a physical therapy student. I know I was. But I also learned so much from him. And then when I got to come back as a medical student, they actually asked me to teach functional anatomy with him. And so I got to know him in a completely different way. And he was a wonderful teacher, and a really fun and insightful person. So if I had to pick one, it would be him, and I think the other one would be Mary Smith. I rotated with Mary Smith on a HEMONC rotation. I think I was a third-year medical student. That was the only rotation that I went, I could maybe do this instead of orthopedic surgery. And it really was about her and her way of teaching, but also the care that she gave to her patients. And I think that's what I learned from her. I mean, it's a really difficult specialty, and she did it with such grace. You know, I love the Eleanor Roosevelt quote, "Do one thing every day that scares you." I think that's how you get better and how you improve and how you reach heights that you didn't think that you could reach. So that would be one big piece of advice. And I think the other one is the way that, and I'm going to start to sound like an old geezer here for a minute, but the way that medicine is going and, you know, other things, the business aspects of it, I think it's not a job. It is a calling, and it's a privilege to take care of others. And I would tell them that they need to keep that in mind as they go to work every day. I would like to be remembered as somebody with tenacity and integrity, and somebody that stands up for the underdog. And probably I'd throw in there a sense of humor.